The assisted reproduction sector has also suffered the impact of the pandemic. Billing of private clinics has fallen by about 6% in 2020, up to €460 million. Now, the sector looks towards its recovery and trusts the treatments that were postponed due to the health crisis caused by Covid-19. The pandemic has meant a slowdown in the upward evolution that this sector had registered in recent years, explained Vicky Yeague, head of sector studies at DBK Informa. And it is necessary to take into account that these clinics had to close between 2 and 3 months at the beginning of the sanitary crisis. Due to the slowdown in activity, 14,000 assisted reproductive techniques were discontinued in all Spain. Translated into possible births, it could mean 4,000 fewer children, according to the data provided by Antonio Arias, director of the Assisted Reproduction Unit of the Cuayanzalid Zaragoza Hospital. When activity resumed, we observed an acceleration in the recovery of all services, added Yeague in conversation with Inversia. When activity resumed, we observed an acceleration in the recovery of all services, from the National Association of Assisted Reproduction Clinics of Spain, ANASA. Its president, Ignacio Mazzanti, explained that the activity has not yet recovered to levels before the pandemic, among other things because there is a shortage of international patients due to travel restrictions. But nevertheless, they hope to return to the rhythm prior to the health crisis in 2021. Specifically, the consulting firm foresees a 6.5% growth by 2021. By 2022, the increase will be around 4%, because the economic impact of the pandemic can affect the demand for assisted reproduction services, Yeague argued. According to DBK Informa data, in 2018 the growth of this sector was 5.5% and in 2019 5.8%. Despite the fact that pre-pandemic levels will not be reached in 2022, Yeague has indicated that this industry still has great growth potential. Companies are also beginning to see these green shoots after closing 2020 with a general drop in turnover, although the same situation has not occurred in all companies. In the case of Over Clinic, the Malaga company did not stop its activity and assures that it closed 2020 with excellent results. The company launched a telemedicine service so that patients could continue or start their treatments from home. For his part, the medical general director of IVI, Antonio Requena, has pointed out that, after the pandemic, our activity recovered in a very positive way, being similar to the previous year. Cuayanzalid has returned to activity. At the moment, we are on a rebound and carrying out the treatments that were not done last year, said Arias. And the growth potential is also seen in the acquisitions. On June 24, Axis Health, an international strategic holding company focused on the development and management of top-level healthcare centers in the fields of fertility and women's health, announced the acquisition of Repro Clinic and Over Clinic Barcelona.